Okay, Omicron is a new variant that's been defined as a variant of concern. This is because it is thought to spread very rapidly and could have impacts on people who have been vaccinated, but also could have worse impacts, worse outcomes for a number of age groups. It's been identified predominantly in southern Africa, and we have a small handful of cases at the moment that have been confirmed in the UK. Viruses mutate all the time, and not every one of the very many variations and mutations causes concern, but this one has. And like Delta earlier in the spring, it requires some surveillance of where it spread to and understanding that, and obviously with that attempts to stop it becoming endemic in the population, which is why government has stepped up travel guidance and red listed the countries from which this mutation is found. And also we're now obviously rolling out other public health measures in the UK as a way of trying to contain the spread. There are certain signs that it's certainly more transmissible in terms of evading vaccination and the outcomes on a population with the age spread and vulnerabilities of the UK rather than in southern Africa. This is going to take a couple of weeks to actually draw together that conclusion, but we do act from a principle of protect, cause no harm, and we do believe that there would be harm from allowing this variant to spread widely in the UK population. So that's why we're beginning to ramp up some measures. I think people should be cautious rather than worried. I think, as I've said, if we worry about every mutation, even though this one has been called out as a variant of concern, then we may never get into a state where, as a population, as communities, that we return to some degree of normality. You can't sort of focus on infections all the time and try and prevent every single infection, because otherwise you'll be worried in the middle of summer about summer colds. You'd be worried as you go through into autumn about seasonal flu. You'd be worried all the time, and we actually don't want people to carry around that burden, but we do want people to be cautious, which is why we're asking for certain measures to be put in place. For example, from today, back in shops and some other premises, people have been asked to wear face coverings. Our schools were already asked last week, before this variant was identified, to return to wearing face coverings in communal areas, and that was as a result of the high number of cases that we were getting in the county, and that's one of the measures that we would put in place where you see an increase. But we've also got changes to isolation. If you have been a contact of a suspected case of this, and you will be contacted and identified as such, then whatever your vaccination status, you will be asked to identify for the full isolate for the full 10 days, and that's a change to what the advice has been. Of course, one of the things we really want to promote here is still to get vaccination, 2 doses and the booster if you're eligible for the booster. And yesterday the government announced an almost doubling of the throughput through the booster programme, and trying to open up the capacity to do those extra doses and narrowing the time windows. That's going to take some time for the services on the ground, a week or two to open all those slots and to have all the staff in place to provide that. But what I do urge is that people keep trying to get those appointments and to get their vaccine, because that and the booster will absolutely give so much protection, not just with the new variant, of which the actual detail we don't know, but the biggest variant at the moment is the Delta variant, which has been here all summer, and we know that vaccination still does protect against that developing into some quite serious illness. It's likely that any any protection or loss of protection will be marginal, because what we already know about Omicron and its similarity to the Delta variant and other variants that vaccination does protect against is very, very close. However, as I say, the scientists want to be certain on this and to give us all a clear sense of the scale of any concerns that they have. But now we're asking people, if you're going into places where there are new people and new mixes of people, then use the lateral flow test as a way of protecting yourself and also protecting yourself from bringing the virus to others, because you may be asymptomatic and not have any sense that you're ill, carrying the virus. I don't think we should really be alarmed at every mutation of the virus. As I say, I think we would endanger recovery in sort of watching all the genetics so closely. We have fantastic scientists in this country. We have a fantastic new UK Health Security Agency, which has some of the best, if not the best, genomic testing capability in the world. So all these things will always be studied, and we will always have scientists looking at this. And also we have a very public, open book approach to science in this country, so that these things are put out to the media, they are reported by the press. But if every single mutation we consider a deep concern, we won't ever move beyond feeling that we are always at a high rate of threat. And I think we do have to try and move beyond that, because vaccination and some of the other treatments, drug treatments and hospital care, are taking us through from a position of COVID being very, very harmful with a high degree of morbidity and mortality, to something that we will have to live with throughout our lives, in the same way that we do with seasonal flu. So I think cautious is the way that we go about reducing the risk of transmission, if there is any in East Sussex, if there is any in circulation of the new variants in our places. And that's just taking a few extra measures over what we've been doing on a routine basis for the last few months.